Sierra Leone's president has ordered the country to go into lockdown for 4 days to try to contain the Ebola virus. From the 18th of September, no one will be allowed out of their homes. The World Health Organization says almost 4,000 people have been infected across West Africa since the start of the year. It spread from Guinea to Sierra Leone, Liberia, and most recently Nigeria and Senegal. The number of deaths has now gone past 2,000. Erica Wood has more.
Wheeling out onto the tarmac, the third American aid worker to be infected with Ebola since this outbreak started. A doctor, he had been working in Liberia when he was found to have the virus.
He has a very serious infection. We know that this can be associated with mortality. We're going to very aggressively support this patient and hope for the best.
He'll be treated in a secure isolation unit in Nebraska. And while the other two infected Americans have survived, the West African strain of the virus has so far had a 50% fatality rate. Hospitals inside the affected countries are struggling to find enough staff to help treat Ebola patients. Many local staff have fled in fear, and it's been difficult to properly educate the public on how to keep themselves safe from the virus. The UN Secretary General has repeated his call for $600 million to help contain the outbreak.
The goal is to stop Ebola transmission in affected countries within 6 to 9 months and to prevent the international spread of the virus. This can be done only if the urgent and necessary mobilization is done both in the affected countries and by the international community.
And in Switzerland, around 200 experts have been discussing a roadmap for tackling the virus. The World Health Organization has approved the immediate use of the blood of those who have survived to treat new patients with transfusions.
2 promising vaccine candidates were identified. One is called chimpanzee adenovirus Ebola and the other one VSV Ebola. Safety studies are currently underway in the United States of America and soon to start in Europe and Africa.
They've already had promising results in animal trials, but the first data on how effective and safe they are on humans won't be available until November. Only then will they be able to decide whether to start mass production and to distribute them inside the affected countries.
This is a huge, serious challenge. We are organizing to meet it, and I'm convinced we can succeed.
The clear message from experts and leaders is there is no quick solution. Containment and widespread effective treatment is still months away. Erica Wood, Al Jazeera.